today I wanted to talk to you about a really important subject that I feel so many people here in the United States don't talk about enough, and that is insurance coverage, specifically when it comes to women's health and fertility. This is something that I dealt with all the time as a fertility nurse, and it was always shocking to me how much we don't know as consumers of health insurance until the time comes to actually go through a procedure. So I wanted to come on here and share my tips and tricks in the hopes that it would help some of you navigate the craziness of insurance coverage. All right, the first thing that I want to talk about is your actual insurance card. So lots of us don't realize that there's a lot of really great information on this card. The first thing you want to look for is to make sure that your primary care provider is listed on your actual insurance card, or that you have a primary health provider that's been linked to your insurance account, because you're going to see, as well as on your insurance card or when you log into your insurance account, that you're going to have a tier 1, a tier 2, and a tier 3. So these could all be in-network health systems, but the further out you go, so that third tier is going to be a lot more expensive out-of-pocket costs in terms of co-pays, or just out-of-pocket costs that you owe. So tier 3 is going to be your most expensive, tier 2 is going to be the middle, and tier 1 is going to be maybe no copay or just a tiny copay. So when you're looking for providers, it's really important to note which tier you're looking for, and specifically always make sure you're going in network, unless obviously you need to go out of network to get the provider that you need for a specific procedure. Also on the card, you're going to have something called an RX BIN number. This is critical when it comes to your pharmacy benefits. So lots of us don't realize that our insurance actually works with another carrier called your pharmacy benefits provider. And there are lots of specialty pharmacies here in the United States that work with various insurance carriers. Those can include an Aetna specialty pharmacy, CVS Caremark, Perform, Freedom Pharmacy. And these pharmacies come in handy or come into play when it comes to injectable medications, specifically for IVF coverage. So I'm going to come back to that one. Then you want to look at the back of your card. Here's where you're going to find a whole list of numbers. This is how you can reach your insurance carrier and how you can reach your pharmacy benefits provider as well. So you can always call there and get the information that you need. So make use of those numbers, get to know your carrier and what's covered and what's not. One of the biggest questions I get asked at Binto is hormone testing. So this is awesome that everyone is asking about this, and what you want to do is make sure that your hormone tests are covered. A lot of these tests, if they're not ordered properly, you're going to end up with a bill. So I'm going to walk you through how to make sure that you don't get hit with a big bill that you weren't expecting. First thing you're going to do is make use of your health insurance card and call that number on the back and speak with your carrier to make sure that you know the ICD-9 or ICD-10 code that your provider needs to use when they are ordering your lab tests. Most of the time, a lot of us have coverage under other procreative management or preventative health testing. So if you're going in for an annual checkup, if you're going to see your OBGYN, oftentimes you can have your physician or NP or PA order these labs and get it tested. And this would cover things like your thyroid levels, testosterone, estrogen, anti-Müllerian hormone, you name it. Those hormones should be covered if we order them under the right ICD-9 or 10 code. The second half of that is making sure that you're going to the right laboratory. So everyone who has insurance coverage is capitated to a laboratory. So for instance, if you're in Philadelphia, you might be capitated to Jefferson Health System Labs, or you might be capitated to Penn Medicine Labs. If you're outside of a health system, you might be capitated to something called LabCorp or Quest Diagnostics. fertility can be incredibly overwhelming, and even more so when you add insurance into the mix. So this is really when I got to know all about insurance carriers, when I was working as a fertility nurse, because there's so many different levels of services that can be offered as a benefit under your insurance provider. And not all of us have insurance coverage. If you are living in a state, I believe we are past 12 states now that offer a mandated insurance coverage for fertility and IVF treatments, which is amazing. So if you are in one of those states, you can check out that information online, I believe under Resolve Network, and you can see if your state offers the mandated insurance mandate for fertility treatments. These two states that I know about very well would be New York and New Jersey. So for the rest of us who are not in states where we have the mandated coverage, it all comes down to our individual carrier. And not many carriers or companies that we work for offer fertility treatments as part of their insurance package, which is really crummy, so it can leave a lot of us out. The basic thing that I would say the majority of us are hopefully covered for would be to be able to go and see a reproductive endocrinologist. So this is a fertility specialist. So that's going to be the specialist copay that you find on your insurance card under those tiers. And again, try to find someone in network if you can, because it's going to be a little bit more cost effective. And then you are going to have something called monitoring coverage. So there's the actual physician coverage, but then once you get into the world of treatments, monitoring is going to be the most basic coverage that you can find. So this is that coverage that's going to pay or cover part of the cost for your transvaginal ultrasounds or any of your blood work that's done in the office. So hopefully, if you are trying to conceive, you do have some coverage for this. The next stage would be actual treatments. So things like IUIs, intrauterine inseminations, and IVF. These are more advanced procedures. Some insurance carriers, again, may cover an unlimited number of IUI procedures. Some may only cover a few. And then IVF, most people in the US, unfortunately, do not have insurance coverage for IVF. And it's very, very expensive. So the procedure itself can cost anywhere from like 10 on the very low end to about 20,000. And then if you bake in other things like genetic testing of your embryos and the medications that you have to take, we talked about those fertility medications and coverage earlier, then your cost is going to go up. Here's where it gets even more tricky. You might have insurance coverage for the IVF procedure, but no medication coverage. Because again, your basic insurance medical coverage is different from your pharmacy benefits coverage. So that's why I want you to always call in advance to figure out what type of coverage you have before you get yourself into anything, and just so that you're aware. And then vice versa, you could have medication coverage, but no IVF coverage. So it's all a little bit confusing, and you want to make sure to go ahead and do the work and get informed. My last tip for you is to make sure that you are connected with a primary care provider or any provider that is going to listen to you and take care of your needs. So if you ever feel that you're not being heard or listened to by your provider, then maybe it's time to move on and find someone else in network who can take care of you and your needs. The other thing that I want to put down here and say is that if you are trying to conceive and your OBGYN is not giving you a referral to see a reproductive endocrinologist, then it's also time to move on from that provider. We've been saying this a lot here at Binto, and we are always here for you. So if you need to work with one of our providers, please feel free to book a fertility consult, and we can help you navigate this process and answer your questions